Hi, my name is Megan Roberts, and I am a consulting manager at SullivanCotter. Professional services arrangements, or PSAs, are a common way for hospitals and health systems to contract with physicians or other providers for specific services. These agreements can cover everything from on-call coverage to medical directorships to providing subspecialty clinical care. When structuring and valuing a PSA, how should organizations ensure compliance with both fair market value and commercial reasonableness? When structuring and valuing a PSA, how should organizations ensure compliance with both fair market value and commercial reasonableness? Fair market value ensures that the compensation reflects what is typical in the market for similar work and is independent of the volume or value of referrals. In order to conduct a fair market value assessment, the contract should clearly define the following three elements. First is provider type. It's essential to identify who is delivering the coverage, as the market data differs between physicians and advanced practice providers. This distinction ensures appropriate market value is applied. SullivanCotter administers several of the largest surveys available in the market that are focused on physician and APPs, capturing key elements such as total cash compensation, productivity, leadership pay, call coverage, and much more. We draw on these data along with other survey sources to accurately evaluate the coverage provided. Second is coverage type. Clearly defined work effort expectations are critical when evaluating a PSA. Is the coverage on-site or off-site? Can medical director responsibilities be performed concurrently with clinical duties? These questions help in determining that the coverage is appropriate and avoids double counting the same hour of work, a common FMV compliance concern. And finally, the financial structure. Understanding who retains professional collections and what expenses each party incurs is key. Many PSAs operate under an income support model where the group keeps collections but requires additional subsidy from the organization in order to cover their costs. This subsidy is what triggers the need for an FMV opinion. Transparent structures and contractual language that requires regular financial reviews helps ensure compliance and reinforces the basis for ongoing support. And then finally, commercial reasonableness goes a step further. Even if the rate is fair, the arrangement must make business sense for the organization. In other words, would a reasonable entity enter into this agreement if there were no potential for referrals? Does the organization truly need these services? And is the structure consistent with its mission and operations? Organizations should carefully consider both the economics and the intent of PSAs, as these are closely scrutinized by regulators. SullivanCotter helps clients design defensible, well-structured PSAs that align with regulatory standards and balance compliance, sustainability, and fair provider compensation, an area where SullivanCotter's expertise can add real value. For more information or to discuss how we can support your organization, please don't hesitate to reach out to us.